Hi everyone and welcome to a new video. My name is Fede and thank you for watching. In today's case we will be treating a molar with an old composite filling. The reason for replacing this composite filling is that there is a crack visible in it. Enjoy watching the video, bye! As usual in cases like this, we start by applying isolation with a blue rubber dam, which you can see as the blue background. The rubber dam not only provides me with a clear view, but it also lets the patient swallow comfortably during the procedure and prevents anything from falling into the throat, and it allows us to work cleanly and dryly, which improves the filling's quality and longevity. We've already numbed the molar in this case, ensuring the treatment is as comfortable as possible for the patient so they won't feel any pain, allowing me to work calmly without causing discomfort. As I mentioned, we are working on a molar that already has a composite filling. Sometimes the adhesive that holds the filling to the tooth can come loose, potentially causing a crack in either the filling or the tooth. And this needs repair, so imagine it as a slight leakage between the filling and the tooth. When the adhesive fails, this leakage can lead to a new cavity under a filling, resulting in decay if left untreated, which is why we are addressing it. In this video you can see a part of the filling come loose during preparation, which is then removed. As the filling is almost entirely removed, you will notice brownish tooth tissue in the center of the molar, decay, that has formed under the old filling, which needs cleaning. So we will remove the entire old composite filling because I don't trust the bond of the remaining portion. Even though there isn't decay under the entire filling, I'll still remove and replace it all. You will see me using a cylindrical diamond burr with the aerator handpiece. And this handpiece rotates incredibly fast, and the diamond burr helps clean the enamel, which is actually the hardest tissue in the human body. And that can only be cleaned effectively with such a burr. But since this burr rotates at such high speed, we use water cooling to prevent the heat generated from damaging the tooth's nerve. Next up, I will be using a round carbide burr, which rotates more slowly than the diamond burr, reducing the heat and eliminating the need for cooling. So working without cooling gives me a better view when cleaning the molar. Over here you will see me switching lights to check for any remaining decay inside the tooth. But we can also use something called Caries indicator, and this is a pink liquid that highlights only the infected tissue. This solution allows us to see exactly where we need to clean. So after we have rinsed it off with water, I use a round carbide burr again for the inner tooth cleaning without cooling to maintain visibility. After rinsing, it may appear that the tooth is clean, but to be too rough, I reapply the Caries indicator to ensure we have removed all the decay. And as you can see, some cariogenic tissue remains, which I clean with the round carbide burr again. It's not always necessary to remove every last bit of the pink stained dentin in the tooth center, as getting too close to the tooth's nerve risks damaging it, which we aim to avoid at all costs. Once I'm satisfied that the dentin is clean, I round off the sharp edges of the enamel, and this process is known as beveling, which enhances the bonding of the composite filling and gives a better shape. Since we are working on the enamel, I switch back to the diamond burr with cooling. Over here I will double check the preparation. And next I place a matrix band to restore the tooth shape and prevent it from sticking to the adjacent teeth. This will be kept in place with a wedge and a separation ring to create a proper contact between the two molars. And sometimes after applying this, you will see a very tiny gap between the matrix bands and the tooth, as you can see over here. And what I do in cases like this is adjusting it by adding a bit of Teflon tape in that area. So after tightening with the ring, the gap disappears, ensuring that the composite won't leak. After all this, we etch the enamel with the blue phosphoric acid, roughening it to improve the bonding. And after we rinse away the blue edge with water, it's crucial to work on a dry tooth surface since composite doesn't bond to a moist surface. Once dry, we apply a primer to the dentin, blowing it with air followed by a thin layer of bonding agent, which I avoid blowing to reduce post-filling sensitivity. We cure the bonding with a UV light. The first layer of filling material is a flowable composite with a liquid consistency that reaches into every corner, and this is followed by a sturdier composite layer for greater resistance to chewing forces. We harden each layer with the curing light before adding the next, since curing thicker composite layers wouldn't allow the light to penetrate, which would leave parts of the filling soft. I try to replicate the tooth's original shape by molding the composite with various tools and removing any excess soft material. Once the final composite layer is in place, we cure it fully with the light, and then we remove all the shaping aids, including the separation ring, the wedge, the Teflon tape and the band. I use the curing light one last time to ensure everything is fully hardened, even in the deepest areas of the filling. And finally, I use a sickle probe to check for any excess material, which we smooth with a finishing burr containing fine diamond particles for a polished finish. As we wrap up the filling, I want to thank you all for watching. If you enjoyed this video, please give it a thumbs up, and if you would like to see more informative videos with commentary, consider subscribing. We are nearing the 100 subscribers and I'm thrilled about that. If you want to be a part of this journey and help us reach that milestone by the end of this year, hit that subscribe button so you don't miss any videos. Once again, thanks for watching and I hope to see you soon. Bye!